complications you have on your leg. When did you first notice?
Oh,
What led to this?
about 6 months ago.
6 months ago.
I don't know what they call it, but anyway, it just busted.
It just busted?
Yeah.
What essentially occurs is a cholesterol-type material surrounds the vessel and doesn't allow the oxygen and the nutrients that is rich inside the blood vessel to get out of the vessel into the tissues and the cells that need these nutrients. Therefore, you have the surrounding tissues starving while there is richness of blood and oxygen nutrients inside the blood vessel. Now, alongside the blood vessels are nerves. And those nerves not receiving the oxygen and the nutrients lose function. And as they lose function, the patient will experience a loss of feeling. And this starts from the tips of the fingers and the tips of the toes and works its way back up the extremity in a stocking-like distribution. As if you were going to roll a stocking on, that area will become numb. And the infection has a greater likelihood to get into the bone, and you'll get osteomyelitis. These are more advanced problems, and they take hospitalization and IV antibiotics and more advanced treatment.
I had a blister on the bottom, and I was soaking it in Epsom salts and alcohol, and it seemed like it was healing up. It busted, and then it started getting a crust on it, but gangrene had hit it, and then it was hurting me all the time. And I knew I was going to lose it. I went home, I told Betty, I said, I'm going to take a bath, and I want you to take me to the hospital. I knew I was going to lose it, so, hey, no use crying about it. Go ahead home.
Well, the diabetic, Medicare diabetic program has provided the Medicare patient with diabetes and one other complication, such as a deformity of the foot, poor circulation, a callus, anything like that, they'll provide them with shoe inserts and custom shoes. And these are vital to help prevent the breakdown of the skin. So these soft shoe liners, which can be replaced every 4 months because they're softer than the skin, so they'll break down and flatten out rather than having the skin breaking down and forming a hole in it. And these are custom made in many cases from a casting, if that's necessary. Otherwise, a stock shoe that has plenty of room can be used. But preventing the breakdown of the skin will prevent the infections, which result in bone infections and loss of part of the foot, as you say, amputations.
I check my feet every day. You know, that's one of the things in that program that they stress, that you only have two. You only have two, so you have to take care of those two. So I make sure I check every day. Any kind of little aches or pain, I'm looking and checking to see if I have any cuts or anything like that on a daily basis. Yeah.
Basically, a patient or an individual with diabetes would want to look with their eyes, feel with their hands for any hot spots. They want to avoid extremes of temperature, nothing too hot, nothing too cold. Check the bath water, the shower water with an elbow or a hand, because if they just walk into scalding hot water, they may not realize it. And we have seen quite a few diabetics get third-degree burns from a shower that they didn't realize was even warm. They want to avoid any elastic or compression around the lower extremity, around the limb, around the foot, because that would decrease circulation. So stockings with an elastic piece, or rolling the stocking down, as some of our older patients have a history of doing, will cut off the circulation and further cause problems.
You have to have The shoes have to be very comfortable. You need to have shoes a little bigger than what you normally wear, and plus it includes socks. You just can't wear, a diabetic can't wear just any kind of socks. They have special diabetic socks, which give you a little breathing rooms on the toes and everything, and that's very important. You have to keep your feet nice and dry.
Well, if you know you got diabetes, you have to take care of it. My brother had diabetes before me. Oh yeah, he does what he's supposed to do.
Which of the following can prevent feet complications? A. Inspect your feet daily for cuts, bruises, hot and cold spots. B. Eat a balanced diet including adequate fruits, vegetables, and fiber. C. Wear appropriate socks and shoes. D. Engage in regular exercise, reduce stress, and follow the recommended medical plan by your doctor or healthcare provider. E. All of the above. The correct answer is E. All of the above are correct measures to prevent feet complications.
Not know that they have it in many cases.
Basically, a patient or an individual with diabetes would want to look with their eyes, feel with their hands for any hot spots. They want to avoid extremes of temperature, nothing too hot, nothing too cold.
They cut it up.
We do not recommend any medication changes. Rather, patients should seek medical advice from their doctors or healthcare